Good to have you with us. This is the Daily Report for Thursday, January 20th. To every beginning, there is an ending. And this is precisely why some health experts are now predicting a finale to Omicron's presence over in the US. We have more later on the program. Here first is the general COVID-19 update. So what is the latest here in Korea?
Sunny, as the Omicron variant is on its way to outnumber the Delta variant here in the country, Korea observed an increase in infections this Thursday. And for the first time in almost 4 weeks, we're seeing a figure in the 6,603 to be exact as of 12 a.m. And that is especially an increase in domestic transmissions, however, a dip in imported cases. Now, in the past days, infections have been now going up from the 3,000s to the 4,000s, 5,000s, and now we're in the 6,000s. And it is also an on-week jump from last week by around 2,400 cases. Now, by region, there's been especially an increase in Gyeonggi-do province here, which posted its all-time high for a single day this Thursday at over 2,400. It's also more than 1,000 cases more than the capital's whole. Also, we see many places here in red, which means many places across the nation are seeing triple-digit figures of infections. And in some places, the situation is looking very different because of the Omicron variant. And our Yeon-sung will have more details on that in a bit. But now let's move over to the general figures here. It's been exactly 2 years now that Korea has seen its first COVID-19 case. And in that span, we have accumulated 712,503 infections and 6,480 COVID-19 related fatalities. Now, if we go over to these numbers here, there's been a positive development in the number of patients in serious or critical condition, which has now dropped to the 400s. Moving over to our vaccination figures, 44.5 million people in the nation got at least one COVID-19 shot, and 43.6 million are fully vaccinated or got their second shot. Now going over to our booster shots, now 47.2% got an additional dose. That's around 24.2 million. Going over to the international figures, there's been an increase by 4 million new infections in the past day as of noon Korea time. And also, we're seeing a 5-digit figure of fatalities for the first time in quite a long time now. Now going over to the 20 countries with the highest numbers of infections, the US posted again around 1 million new cases. And also France, for the second straight day, reported more than 400,000 new infections, while Germany, with some over 100,000 cases as well, has posted its highest caseload for the first time for a single day, and that is actually 110,000 new infections. And those are the general updates that I have for now, but I'll see you back in a bit. Sunny?
All right, so thank you for the global tallies. Now, Omicron is making its presence felt here on the local front. For more on that, Kim Yeon-sung joins me now. Yeon-sung, welcome back.
Thank you for having me, Sunny.
Right, so let's begin with the spread of Omicron here on the local front.
Well, Sunny, record numbers are being reported in regions nationwide. These include places where Omicron is already the dominant strain, like the city of Gwangju and Jeollanam-do province. For example, Gwangju has 350 new local cases on Wednesday, topping 300 for the first time. And with Jeollanam-do province reporting close to 160 cases, the southwestern region of Korea surpassed 500 cases, which is another first. The city of Pyeongtaek in Gyeonggi-do province found 90% of their analyzed local case samples to be Omicron. The city combed out more than 300 new cases, and Gyeonggi-do province, where Pyeongtaek is located, hit a fresh high with more than 22,400 new cases, as Soa briefed us earlier. Chungcheongbuk-do province also saw more than 170 local cases, punching in a new record high as well. The city of Daegu has also seen a case count of more than 350, and this is a number unseen since it was the epicenter of the virus in early 2020.
Right, Yeon-sung, against that scenario then, so chances of an unprecedented daily tally in COVID-19 infections here on the local front is very likely in the near future.
Yes, it is possible. So the latest peak we witnessed in the country was actually back in December 15th last year, and that tally stood at around 7,850. Authorities say that cases may top 7,000 by tomorrow by the earliest. And with Omicron becoming this dominant strain and expected to take up 80 to 90% of the total cases in 3 weeks, daily cases could come close to that number, even surpass that 7,850 mark.
Right. Now, do remind us about the Omicron-tailored strategy that Korea is planning to adopt in the case of that particular scenario.
Right, so when cases hit 7,000, authorities are planning to pivot into this more faster and more efficient containment strategy. It will speed up contact tracing and prevention, strengthen quarantine on arrivals, and expand at-home COVID treatment for mild cases of Omicron. The isolation period for confirmed patients will also be shortened from 10 to 7 days.
Right, so 7 days meaning 1 week. Yeon-soo, what's the latest with regard to our vaccine pass system now?
Right, so before going on, I would like to mention that authorities have relaxed their posture on vaccine pass rules, but that does not mean in any way that they're undermining the importance of vaccines. In fact, they continue to emphasize that vaccinations are the best defense against the Omicron variant. Now, that being said, vaccine pass exemptions have been extended to people who couldn't complete their regimen because they've shown an adverse reaction or were hospitalized after the first dose.
Right, Yeon-soo, correct me if I'm wrong, but hasn't that always been the criteria for vaccine pass exemptions?
Right, yes, that has. But before, causality had to be proven between the reaction and the vaccines. But there were a lot of complaints here and there because establishing such a causal link in a clear manner was very difficult. Now the government is granting exemptions to anyone who has experienced severe reactions or was hospitalized within 6 weeks of inoculation, even if causality cannot be proven. With this move, vaccine pass waivers will be extended to roughly 12,000 to 7,000 people.
Right. And staying with that, who else could become eligible for these exemptions, Yeon-soo?
Well, the exemptions could be extended to people with specific health conditions. For example, health authorities are considering to include in the list people with Guillain-Barré syndrome, which is a rare immune disorder, and people with cerebral venous sinus thrombosis, which is a blood clot in the brain. There have also been a lot of requests to add pregnant women to the list, but the government has made clear that that won't happen. They said, in fact, vaccines are especially recommended for pregnant women since they're at high risk of severe health outcomes after catching COVID-19.
I see. What about vaccine passes for minors, Yeon-soo? Has there been any progress on that front?
Well, that's still an ongoing legal battle, I'm afraid. It's an ongoing battle with people who support vaccine pass for minors and those who are opposed. On one side, there is the government. On the other, there's this whole administrative court's decision to suspend vaccine pass for minors. And that decision is also backed by various citizens and various health experts. The case will be handed off to this whole high court, so that decision is to come. Hopefully, there will be a ruling before March to clear up any uncertainties for everyone involved.
Right. All right, then, Yeon-soo, thank you very much for the report and see you on Friday. Right, now for more coverage of the COVID-19 situation overseas, Soa is back at the desk. Soa.
Hi again, Sunny.
Right, let's begin over the UK, where I understand a drop in COVID-19 Omicron infections, of course, has led to a potential change in COVID-19 strategy there.
Right, Sunny. So British Prime Minister Boris Johnson announced on Wednesday that there is going to be an end to strict COVID-19 measures that were implemented amid the Omicron wave since December. And he cited scientists believe that Omicron has peaked nationwide now. So let's take a listen to what the Prime Minister had to say.
The Cabinet concluded that because of the extraordinary booster campaign, together with the way the public have responded to the Plan B measures, we can return to Plan A in England and allow Plan B regulations to expire. As a result, from the start of Thursday next week, mandatory certification will end.
That meaning vaccination certification won't be a must at indoor venues, but organizations can choose whether to continue to use the country's NHS COVID pass. Also, people won't be asked to work at home anymore, meaning it's up to employers to arrange returns to offices. Another big change coming up starting Thursday is that wearing face masks in public places and at schools will no longer be compulsory. The Prime Minister also mentioned that the legal requirement on self-isolation of COVID-19 patients expires on March 24th, and it may even be forwarded, which would be part of efforts to start treating the coronavirus like the flu. Following the Prime Minister's announcement, the UK's health minister touted the country's booster shot campaign, saying 15 million people got their additional doses since Plan B was announced back in December, which includes a record of over 1 million vaccinations in a single day.
Right, so Swan, no face masks, no vaccine passes. Is the Omicron situation in the UK under control then?
Well, Sunny, daily infections stand at around 93,000. That's the past 7-day average in the country. And this Wednesday, more than 107,000 cases were reported. So although that is still a very high number compared to us here in Korea, for instance, where the Omicron variant has not yet become the dominant strain, officials in the UK are citing lower death rates compared to the past. But even the Prime Minister did mention that in some places like primary schools, cases are likely to continue to go up for the time being. So at this point, it is, I guess, more up to the individuals whether they still decide to wear their face masks or not, for instance. So let's take a listen to some of the mixed responses following the announcement to scrap the earlier measures that I mentioned.
It's about time we get on with our lives, I think, because the variants are getting weaker and weaker. We're all becoming more immune to it, so I don't see a reason why we should just get back to normality.
I would keep it in transport and crowded places like shops where people have to go.
I think it is a bit too early because cases are still very high and you don't know, what is going to happen. Until I think we should have waited a little bit longer until the summer. In summer, it's best to remove all the restrictions.
Right, I see. Meanwhile, over in the US, so I believe President Biden has also spoken about an improvement in COVID-19 related conditions over in the US during a press conference to mark his first anniversary in office, right?
Right, Sunny. The US president said that the country is in a, quote, a better place, but he was referring to the situation a year ago rather than the most recent developments, saying it was a year of challenges. President Biden highlighted the progress made in vaccinations, noting when he was sworn in, some 2 million Americans were inoculated, and now it's 210 million. While the Omicron variant has emerged as a new challenge, Biden said there is no need to panic, promising more efforts from the government that, however, won't come in the form of lockdowns. Emphasizing once again that vaccinations do work, he said efforts will continue in vaccinating and boosting Americans, as well as an increase in testings. And that includes a delivery of 1 billion home tests being provided free of charge. The government also plans to provide the public with 400 million N95 face masks beginning next week. With that, the president hinted there is still a lot to do in curbing the spread.
The COVID-19 is not going to give up and accept things, it's not going to go away immediately. But I'm not going to give up and accept things as they are now. Some people may call what's happening now the new normal. I call it a job not yet finished.
A job not yet finished is what he said. And adding to that remark, he said it will get better. So it got better compared to last year, he said, and there's definitely also more room for improvement coming ahead. And that as the U.S. does not appear to have reached its peak of the Omicron variant yet. And as I also mentioned before, still around 1 million cases are occurring every day.
I see. All right. So as always, thank you very much for that. See you on Friday.
See you.
In our news segment on this Thursday, we begin with harsh rhetoric from North Korea regarding the possible resumption of its nuclear and long-range missile testings, which had been suspended since the year 2018. Now, intentions to this end were reportedly shared during the year's first meeting of the political bureau of the ruling Workers' Party that was presided over by Kim Jong-un. According to North Korea's state-run media, members of the meeting spoke of preparations for, quote, a long-term confrontation with the U.S., including the need to explore the option of, quote, restarting suspended activities. Now, pundits believe the regime may choose to put on display major shows of military might in the near future, as February 16th marks the birthday of the late leader, Kim Jong-il. Meanwhile, President Moon Jae-in is in Egypt for a 3-day visit that includes talks with his Egyptian counterpart on this Thursday. Our Blue House correspondent Kim Min-ji reports from Cairo.
President Moon Jae-in arrived in Egypt Wednesday evening local time for a 3-day working visit. On Thursday, he'll hold a summit with Egyptian President Abdel Fattah al-Sisi to discuss ways to bolster their comprehensive cooperative partnership. They are expected to seek ways to work together in future-oriented and sustainable areas, such as eco-friendly mobility, marine, and digital governance. Egypt has adopted Vision 2030, an initiative to achieve green growth and diversify its industries. Eyes will also be on whether they ink any defense deals, with Seoul and Cairo known to be in negotiations to export South Korea's K-9 Thunder self-propelled howitzers to Egypt. President Moon will also attend a business roundtable to discuss ways to bolster bilateral cooperation in future and green industries, like electric cars, IT, and transportation. South Korea is also seeking a free trade agreement with Egypt, which would be Seoul's first with an African nation. Bilateral trade amounted to $2.1 billion during the January to November period in 2021, up from $1.5 billion for the whole of 2020. Before arriving in Cairo, President Moon was in Saudi Arabia on a 2-day official visit. On Tuesday, he met Nayef bin Falah al-Hashraf, the Secretary General of the Gulf Cooperation Council, to announce the resumption of free trade talks with the 6-member Gulf Group. Comprised of Saudi Arabia, the UAE, Oman, Bahrain, Kuwait, and Qatar, the countries account for over 60% of South Korea's crude imports. If signed, the deal is expected to contribute to stabilizing supply chains and expand trade in products and services. President Moon also visited a construction site of the Riyadh Metro, a 6-line subway system due to open this year. South Korea's Samsung C&T is one of the companies working on its construction. President Moon's trip to Egypt is the first in 16 years for a South Korean leader. Cairo is the final leg of his week-long tour to the Middle East and Africa.
During Moon's visit, the top office hopes to expand the scope of bilateral cooperation and help pave the way for South Korean companies to enter Africa. Kim Min-ji, Arirang News, Cairo.
Over in the U.S., President Joe Biden hosted a press conference Wednesday evening ahead of his first anniversary at the White House and touched upon a number of domestic matters. Our Min Soo-kyun reports.
On the eve of his one-year mark in office, U.S. President Joe Biden touted the work and efforts made by his administration. While acknowledging the frustration and fatigue caused by the pandemic, he said enormous progress has been made in fighting COVID-19.
I know there's a lot of frustration and fatigue in this country, and we know why. COVID-19, Omicron has now been challenging us in a way that it's the new enemy. But while it's cause for concern, it's not cause for panic. We've been doing everything we can, learning and adapting as fast as we can, and preparing for a future beyond the pandemic.
He stressed that just 2 million people had been vaccinated a year ago when he was sworn in as president. But now more than 200 million Americans are fully vaccinated. Biden said that the country is currently in a better place to fight the virus, citing vaccination efforts, swift testing, and new medications. He reassured the public that the country will not roll back to lockdowns and that schools will stay open. To the new normal, he said it's a job not yet finished, implying that it was too early to make any judgments on his work on the return to normalcy. On inflation, however, he vowed to keep it under control as people are seeing higher prices at grocery stores, gas stations, and elsewhere. Biden said efforts will be made to fight inflation, including resolving supply chain disruptions and cracking down on unfair market competition. Biden also commented on current tensions with Russia over a military buildup on its border with Ukraine. He predicted Russia will move into Ukraine, but vowed unprecedented sanctions, saying Russia will be held accountable if it invades and will pay a stiff price. Min Soo-kyun, Arirang News.
Let's take a look at what's going on in the world now. According to the UAE ambassador to the United States on Wednesday, Yemen's Houthi rebels in their attack on Abu Dhabi earlier this week used cruise and ballistic missiles in addition to drones. These statements by Ambassador Youssef Al-Attaba marked the official acknowledgement that missiles, and not just drones, were used in Monday's attack that killed 3 people and started fires at a fuel depot. He added that while several missiles were intercepted, a few of them weren't, resulting in the deaths of 3 civilians. However, the envoy did not respond to further questions about how many missiles targeted the UAE and how many of them were intercepted. The Houthis said earlier that they fired 5 ballistic missiles and used a number of explosive-laden drones in their attack, adding they targeted the airports of Abu Dhabi and Dubai. However, there was no indication Dubai was hit in Monday's attack. Al-Attaba says the UAE is pressing Washington to designate the Houthis as a terrorist organization. Satellite remote sensing images of Tonga after last weekend's massive undersea volcanic eruptions show the island has been left in ruins and has completely changed the color of the ground surface in the capital city.
We can see from the satellite remote sensing images that there has been very obvious change in the color of the ground surface in the capital city of Tonga.
Comparing images of the same area captured in August 2020, it showed that volcanic ash from the eruptions changed the ground surface color from green to gray. Another satellite image showed the Hunga Tonga Hunga Ha'apai island was seriously damaged by the violent eruptions, while a third group of images show that the eruptions left large amounts of red remnants in nearby waters. However, eruptions did not change the main layout of the capital city. The 2022 Qatar World Cup has opened applications for fans that want to secure their tickets to one of the biggest sporting events in the world. The opening ticket application phase began Wednesday, with tickets and packages set to be sold until February 8th. Most notable are the reduced prices, with residents and migrant workers able to attend games for just $11. For others, individual match tickets are sold for as little as $69, with tickets for the final costing up to $1,607. Event organizers have not yet announced how many fans will be allowed into the stadiums for the tournament, which runs from November 21st to December 18th. Lee Seung-jae, Arirang News.
Right, up next, we shed light on recent foreign coverage of events here on the Korean Peninsula. For that, I have Kim Sung-yeon in the studio with me. Sung-yeon, welcome back.
Great to see you again, Sunny. So a lot of the international media this week focused on President Moon Jae-in's overseas trip as that's going on. Also, North Korea's recent string of missile tests. And there was also a piece on South Korea's balancing act between China and the United States. And finally, on Netflix's demand for more K content. So let's dive right in. Bloomberg says President Moon Jae-in succeeded in selling both soft and hard power on his tour to the Middle East and Africa, from K-pop to weapons sales. It noted that he closed a $3.5 billion missile deal while also hosting a K-pop concert for leaders in the United Arab Emirates. Bloomberg explained that these developments well reflected Korea's status as a growing source of both technological and cultural exports. In the meantime, Egypt's largest news agency, Arirang, noted that President Moon's visit to Egypt is proving to be a turning point in relations between Seoul and Cairo, as Egypt is the first African country President Moon has visited during his presidential term, and that bilateral agreements reached at this time would help Egypt implement its 2030 vision.
Right. And across the border, Sung-yeon, as you mentioned, North Korea remained in the international headlines this week, right?
Of course, Sunny, since the year's start, I have been mentioning week after week about North Korea's missile tests. And the North launched yet another short-range ballistic missiles on Monday, marking its 4th weapons test in a month. So the New York Times indicated that the latest tests have raised tensions at a very sensitive time when South Korea is getting ready for its presidential election in March, and China is preparing to host the Beijing Winter Olympics next month. Now, in the meantime, NPR noted that Monday's test was North Korea's fourth ballistic missile launch in under 2 weeks, when it took the North 10 months to conduct that many ballistic missiles tests last year. The report went on to say that 2022 is shaping up to be a year of heightened tensions between North Korea and the U.S. Nevertheless, some experts who spoke to NPR said the North may simply be following a pre-existing plan and that its recent tests are a normal part of its development cycle for these new missile systems. However, another expert believes the North's weapons testing may continue to grow in scale and ambition, with the most dangerous weapons to be unveiled perhaps between 2023 and 2025 in his forecast, which is when another crisis may erupt.
Right. Hopefully that will not be the case, though. Yes. And staying on the diplomatic fronts, Song-yeon, let's move on to that piece about Seoul's balancing act amid tensions between Beijing and Washington.
Right, Sunny. So I did come across an interesting article, and this was on The Diplomat, about South Korea's role between the two great powers, the United States and China, amid Washington's attempt to recruit South Korea in its effort to build resilient semiconductor supply chains. So The Diplomat explained that Korea seems to have a very important role in the Biden administration's global supply chain restructuring plan, particularly as Washington has been trying to address shortages in semiconductors amid its tensions with China. The report further noted that Korea may be the only country that can cooperate with the U.S. in 3 of its 4 vulnerable sectors that have been recognized by Biden's supply chain report released in June of last year. Now, those 3 areas are semiconductors, large capacity batteries, and pharmaceuticals, while China plays a leading role in the one other area, which is critical minerals and materials. Now, meanwhile, the report pointed out that developments in the region have been viewed with caution by South Korea, given that it's heavily reliant on both China and the U.S., and that many tough decisions lie ahead for Korea as it tries to find that middle ground between the two great superpowers.
Right, and moving on to our final story, Song-yeon, I understand Netflix is demanding more Korean content. Tell us more.
Yes, Sunny, Netflix has big ambitions of luring many more new subscribers, of course. And among the race to global streaming dominance, its success with Korean series like Squid Game and Kingdom can provide it with the direction to winning over the rest of Asia. So Bloomberg wrote that when it comes to Netflix's global ambitions, what comes after the success of Squid Game is what matters more, adding that according to its weekly top 10 list, Korea has contributed more popular Netflix programs than any country other than the U.S. The report also noted that Netflix now hopes to ride its Korean surge to even more success in other parts of the Asia-Pacific. Furthermore, it mentioned that Netflix ended September with 213 million new subscribers, with executives aiming to reach 500 million eventually. An analyst was cited as saying that in order to do that, the Asia-Pacific region represents Netflix's biggest opportunity for growth, hence capitalizing on the current momentum with K-content seems to be the most critical. Bloomberg says Netflix's next move could be to hire top executives with connections to Korea's local entertainment industry, as well as selecting the right content that can travel across different cultures, such as Korean language programs.
Right, I suppose there's a lot to look forward to. All right, Song-yeon, thank you very much for the coverage.
The pleasure is mine.
On January 20th, 2020, Korea reported its first COVID-19 infection. It's been 2 years since then, and the battle continues amid the emergence of Omicron that is rendering our current containment efforts less effective. For more, I have Professor Kim Moon-gyu from Yonsei University. Welcome back, Professor Kim.
Thank you for having me.
I also have Professor David Kwok from Sooncheng University. It's a pleasure to see you again.
Good afternoon.
And joining our session virtually is Professor Ali Mokdad at the University of Washington over in the US. Professor Mokdad, it's been a while. Welcome back.
Thank you.
Professor Kim, we'll start here then. Korea has endured 4 waves of the pandemic over the course of 2 years, and now Omicron is looking to fuel a fresh wave. How do you assess the risks we face?
Well, there's no perfect quarantine system in the world, but if we look back on our experiences, I would like to give praise that what we have achieved. There are some shortcomings which should be corrected, and like a delay in vaccine supply and what kind of vaccine we secured, and we were not so good in early monitoring about the neighboring countries, especially China, and if we compare with Taiwan, they did a very excellent job to prepare for any kind of outbreak even before WHO announced. So I think we are entering a totally new phase of pandemic or endemic, and in which the Paxlovid might play a big role. And I think the risk we have to consider is the overwhelming of health facilities like ICUs, so we should have to prepare more. And if we change our strategy, there might be some confusions in the people and in the medical professionals. So I think we need a lot of efforts to inform this new strategy.
To the people then as well. Professor Mokdad, speaking to US media outlets in recent weeks, you predicted Omicron will peak this week over in the US. Now, do tell us more about your prediction and perhaps its accuracy given the status quo there right now.
Yes, we predicted a while back that Omicron will surge on January 17th, and that's what has happened in the United States. Cases are coming down, have been coming down for the past 2 days. Even hospitalization, the United States started to come down as well. There are variations within the United States. Some states are still have not peaked yet. California, for example, will peak in 4 days. But in general, in the US, cases are coming down, and we're heading into a better days ahead of us.
Right. And Professor Kwok, back here on the local front, when do you suppose will Omicron become the dominant strain here?
Well, it'll be a very much of a rough guess that I'm about to make today, solely because it depends on a different country and different atmosphere, how physically transmissible this new Omicron, which is already known to be much more transmissible than other variants, to actually progress inside the country. So I'm thinking of multiples of factors that are going to affect us. Number one is the fact that, as opposed to other countries such as the US or the UK, we have recently been rising in the rates of booster shots. So we have reached so far about 46% or so, but we're still currently giving them to the elderlies and the people who need them. So as opposed to the UK and the US, who have received booster shots long way before, I think we'll be much better protected from the booster shots itself, fighting against the Omicron. So that's one factor that I'm currently thinking of. The other factor is the fact that we're much more densely populated than the westernized countries. So when it actually happens, we also have a chance that Omicron could shoot up even much faster than the other countries that we've observed. And also, we tend to comply better than these aforementioned countries in the sense that we wear our masks much better. We keep our social distancing on the inside much better. So multiples of factors will come into place when the Omicron starts hitting us. I don't think we are actually in the zone to start shooting up just yet, because we have barely reached about 50-something% in the southwestern part of the country. Once it starts shooting up, though, I don't think it'll take more than a couple weeks to reach its peak, and I speculate that it's going to happen roughly in about 3 to 4 weeks, thinking that we haven't completely gotten into the zone to start shooting up yet. So I think that must take about a week to a couple of weeks, and then it'll also take a week to 2 weeks for the total shoot up, and hopefully we'll go down from there.
Right. And Professor Mokdad, based on your forecasting model then, what can you tell us about perhaps the timing of Omicron's peak here in Korea?
So in our projections, Korea will peak on February 18th, so 1 month from now, and cases will peak at about 140,000 cases at that day. And then, but however, in Korea, as my colleague just mentioned, you have higher vaccination rate, you do much better in terms of mask wearing and social distancing. We're not expecting as much mortality in Korea. The virus itself is less severe than what we have seen before, and our estimates right now, the peak of mortality will be on March 3rd in Korea, about 20 deaths a day when it peaks. So less mortality. However, I agree with my colleague, there'll be a lot of hospitalization and pressure on hospitals, and the peak on hospitalization is expected to be on the 26th in our models, and around 38,000 will be in hospitals, not admission. Total people who are in hospitals at that time. We're seeing in the United States that even in New York City, where it's a very dense population, it came up fast, as my colleague said, and it came down as fast as it's coming down as fast as it went up. But also, we didn't see as much pressure on hospitals in New York City when it came to ICU and intubation. We've seen people coming to the hospital, but less people of those who came to the hospital needed ICU and intubation. But the sheer number of people who came to the hospital overwhelmed our hospitals.
Right, I see. Now, Professor Kim, so Professor Mokdad believes that our cases of Omicron will peak mid-February, and if that is the case, health authorities here have spoken about an Omicron-tailored response strategy. Now, how does this particular containment effort compare to our current framework of prevention guidelines?
Something will be same, but something very different, important is that we used to focus on the total count of the patient. It's going to shift to a focus on a more severely ill patients. And so that's the reason we need more ICU beds, and it's in process right now. Now we have more modality to fight against COVID-19, which is the medicine named Paxlovid and others. Patients with mild symptoms may stay home, and they may take this medication if needed, if indicated. And so medical facilities may more focus on the high risk and highly ill patients. Usually they have some underlying conditions. And private small clinics can join in prescribing this medication, and they contribute more for this pandemic. Since last month, the portion of foreign visitors increased up to 14%, which is a higher portion. And only small portion got a third shot. So we need a strict quarantine measures for these people, and areas exposed to these travelers or foreign workers might need a special monitoring system. Korea has turned into a tide of increasing pattern since last week. It is getting obvious that age more than 60 is decreasing and the younger portion is increasing. And the vaccine program is still going on, which is the main strategy against Omicron. So unvaccinated people more than 12 years of age is only 7.6% right now, but they occupy almost half of the mortalities and the severely ill patients. So that means vaccine is still the main strategy to fight against this Omicron. And there might be many reasons they are not getting vaccinated, but if you are not vaccinated, you need more special care about yourself, wearing mask, keeping distancing, and hand washing.
Right. Professor Mokdad, you've pointed out that the Omicron decline over in the US will be just as rapid as its spread right now. When exactly do you expect Omicron to subside nationwide, across that is, in the US?
in March in the United States we'll have little cases and little admissions to hospitals. So we have a tough months ahead of us, all of us, including you in Korea. You have a couple of months because you're 1 month behind us in the United States. So you have a couple of months that are difficult. Same here in the US, we have 1 month ahead of us that's very difficult. And after that, we should be in good position. And our strategy during the surge of Omicron has been here in the United States unannounced, but it has been mainly focusing on limiting disruption to our normal operations, basically keeping our hospitals running, keeping our essential workers and keeping food on our tables, our supply chain. Countries who have tried to stop the infections didn't have as much luck simply because it's a highly infectious virus, as my colleagues are saying, and it's spreading so fast and even infecting people who are vaccinated. And the problem with Omicron, 80 to 90% of the infections right now that we are seeing are asymptomatic. So you have a lot of people who are out and about infecting others not knowing because they're vaccinated and boosted and they are infected without symptoms and they're spreading the virus.
Right. Professor Kwok, a number of health pundits claim the pandemic will become endemic this year. What are the implications of this transition?
Well, first thing, obviously, we are going to seek to go back to the normal life that we used to have before the pandemic. I anticipate that it'll be very much like what we used to have with influenza virus. So when a person shows up with certain symptoms that indicates that that person might have a certain type of virus, especially with influenza, we used to have the patient inside the hospital and be checked through antigen test. And if that person tests positive, or if that person tests negative but is still suspected to have influenza, then we go ahead to give the Tamiflu. I think when the SARS-CoV-2 becomes an endemic, it means that it'll no longer be as dangerous to the whole population as it was going through the pandemic. So it'll have become much more manageable, meaning that I don't think there will be the need for as strict of a test measure such as a PCR test to test everyone who came into contact with the person of a symptom, also to make sure the person either has the virus or not, but rather I think it'll be much more symptom-based that we start treating people with medications such as Paxlovid or Molnupiravir. But also the fact, I think for the time being though, at least for a while, we'll still continue to have somewhat of a social distancing level because I feel that people will remain still scared of the virus, whether or not it's going to happen again. So I think at least for the first half or maybe going into even the second half of the year, despite countries not mandating such a strict social distancing, I think there will be plenty of people who will be still wearing the mask and still being careful for themselves not to have the virus. But as gradually time passes, I think it being endemic will mean that we will have it much more like any other viruses that we commonly have in the daily lives.
Right, and if that is the case, Professor Kim, should Korea be looking to alter its containment strategy in preparation for COVID-19's transition into an endemic state?
Yes, all of us is going to get immunity against COVID-19 either by vaccinated or by natural infection. And if it's that the case, I mean in the near future, but if it's that the case, this coronavirus is going to be a seasonal viral infection of young children who are not born yet. And people ask me, when is this COVID-19 going to finish? And I say soon, because we're going to have another one called Omicron. And the elderly high-risk group needs a very cautious, and because breakthrough infections and health authorities need to determine the timing for further vaccination or any preventive measures. So they have to wear masks for themselves and for others. Still, there are many blind spots in our world map, and we need to be vigilant for emerging new variants, and especially in lower middle income countries. And even though many things will return to pre-pandemic periods, major hospitals may have to keep quarantine measures for a prolonged period of time because we don't want to spread it inside our hospitals. So yeah, definitely I'm going to wear a mask for quite a long time.
I see. Professor Mokdad, under current circumstances, what are your prospects on the emergence of a deadly COVID-19 variant?
So right now, if you're watching what we are doing here at IHME, we came out today and we said that Omicron will end the pandemic of COVID-19, but will not end COVID-19. And the days ahead, I agree with my colleagues, it will be endemic and it's like flu, we have to deal with it. We're getting better at dealing with Omicron for many reasons, as was mentioned today. We're all exposed either through vaccine or infections. We have better vaccines and we are designing better vaccines. And mRNA allows us to modify the vaccine depending on the variant that's circulating as soon as possible, much faster than we used to do before mRNA was the flu vaccine. And we have also the antiviral medications that now are helping, and they will reduce hospitalization and mortality. And of course, very important, we know right now, if we have a variant of COVID-19 coming up that's severe, we know how to deal with it in terms of wearing a mask and keeping a social distance. In my opinion, the days ahead are going to be much better. We're going to have a difficult time, but we are moving into an endemic phase of the virus. And I agree, children who are not born and not exposed to COVID-19, we need to figure out a way to immunize them and get them the protection that they need.
Of course. Professor Kwok, moving beyond Korean and US borders, Chinese authorities claim Beijing's first case of Omicron may be the result of a contaminated parcel from Canada. What are your thoughts on this?
Well, so I dug a little deeper into the report and found that the reason they came up with such an idea is because they could not trace back any further than to the origin of the Omicron variant that happened in China, other than the fact that he or she actually opened the parcel from Canada. So thereby suggesting that it might have been attached to the parcel or the surface of it. Currently, the data shows that it's really not physically possible for a SARS-CoV-2 virus to stay that long in an unlive surface. So it may barely be able to stand about 3-4 days at maximum, but especially going through certain different processes a parcel has to go through, I think there's a very little chance a parcel going overseas can actually carry this virus. On the other hand, I think there's a great chance that we should still be observing quite well of livestock, especially the felines, that was studied to show as much of the transmission rate as humans in the beginning phase of the pandemic. So if we were to be dealing with, let's say, livestock of, I don't know, cows or cats, I think we should still be observant that they are not carrying any viruses going overseas or even domestic. So that's something that maybe we should think about.
Right, I see. And Professor Mokdad, hospitalizations reportedly among children in the US have soared amid Omicron. What does this reality tell us about Omicron's potential impact on the young?
So Omicron in the United States came during our high season. So usually in the US, there is seasonality in admissions to hospital, which is in winter. So Omicron came during winter. And we know children under the age of 5 in the United States and everywhere in the world are not vaccinated right now because they're not eligible for the vaccine. And many of our children in the United States, especially under the age of 2, have been very protected from COVID-19 through protective measures, so they've never been exposed to this virus. And all of this put together have led to a lot of infections for children. But still, the virus is not as severe as we have seen, the variant, as we have seen with previous variants, but still it's leading to a lot of hospitalization for children and unfortunately to deaths among children under the age of 5. And for children under the age of 18, we're seeing that pattern among people who are not vaccinated, unfortunately.
Which is why vaccination is very important then. Professor Kim, preliminary findings over in Israel show a 4th COVID-19 vaccine shot, however, offers limited protection against Omicron. Now, having said that, what are your thoughts on the necessity of additional shots following a booster shot?
I think that study is a very early and preliminary report from Israel, and I'm sure that they included elderly people. The fourth shot produced more antibody than the third shot, but this antibody is not that effective against to block the spread of Omicron. And I think those elderly groups are the group who are most needed I'm in danger if they get infected. So I think we need the time to find an effective vaccine against Omicron if it's needed. And I guess the role of that medicine called Paxlovid and others, we need that kind of medicine more.
Right. Professor Mokdad, according to my colleagues who are earlier on, authorities over in the UK are planning to lift their COVID-19 prevention efforts, including the wearing of face masks and the need for vaccine passes to certain venues. What are your thoughts with regard to these measures?
I agree with them. I think many countries will do so right now, especially those that have passed their peak and coming down. These measures, they were difficult on society, they were difficult on the government, but they saved a lot of lives. But because Omicron is infecting a lot of people, and by the time Omicron passes, we're going to have a lot of people who are immune to the virus simply by vaccines. So we don't need these measures again. And even if we have another variant that could be more severe than what we are seeing right now, still the fact that we have that immunity and that knowledge of this virus, we will be able to handle it. Yeah, I'm supportive of reducing these measurements, but again, looking at case by case, it's okay to do it in England. It's not okay to do it yet in Korea until, of course, your surge is down.
Right, and staying with such measures, Professor Mokdad, I believe you've also spoken about the need to save testing methods for those who are healthcare workers or those who are exhibiting or showing symptoms, instead of using those testings on people who are asymptomatic or have mild symptoms. Could you explain your thought on that, please?
Yes, here in the United States, we had a lot of pressure on testing, and we were not prepared to do the amount of testing. And in the US, for example, we had at one point of time almost 1 million cases on a daily basis for a week. There is no way we could test everybody who's been exposed to those people or who have been identified as a potential that we need to test. So what we needed to do here in order to make sure that our hospitals are running, that our staff could go back to work, I asked in the United States to, if you are asymptomatic, please don't test yourself, and only go to test yourself if you need to make a decision based on the result of this test, so go back to work or not, and save those tests for those people who need them in order to keep our country running. And I would ask the same everywhere right now, because there is a lot of pressure on testing. We need to be responsible, and we need to only do the testing if we need it, or if save it for somebody who really need it in order to keep the country running.
Right, especially if there is, of course, a severe shortage in testing supplies in the nation. All right, Professor Mokdad, thank you very much for your thoughts. Professor Kim here in the studio, thank you for being with us today.
Thank you.
Professor Kwak, as always, thank you for your insights.
Thank you.
Right, healthcare authorities here are bracing for the rampant spread of Omicron in the days ahead, so do seek to make prevention a personal priority. Thank you for watching. See you on Friday.